Hi, I'm Laura Waters, arguing against the proposition that virtual care works well for all women with HIV. And in some ways, I have won this argument already. Because as Grace Kelly said, we should never say never and never say always. So the idea that anything works for all people is, of course, a false assumption. Just starting with what is virtual anyway, because I think for many services, virtual is nothing more than telephone or email communication, though increasingly services are using dedicated video platforms, Attend Anywhere being an example of a service we use in the UK. Now, moving towards more virtual care that's convenient for people is, of course, a direction of travel that we were already moving in, but this has been greatly accelerated by COVID for obvious reasons. And that's reflected, certainly in the UK, by a number of publications and guidelines, for example, in the British Medical Journal, from NHS England, from the General Medical Council, from the British Medical Association, and from the Royal College of Physicians. For me, though, there are three key considerations. The first is feasibility, the second, suitability, and the third is preference. Starting with feasibility, thinking about access to hardware, to software, and to private space, and also dealing with existing communication challenges, for example, for patients where for us, English is not their first language, or people who are deaf. And access to hardware and software isn't just an issue for patients, it's also an issue for our NHS services. Now, thinking about smartphone ownership, considering the UK is a high income country, in 2019, more than 20% of people didn't own a smartphone. This was not surprisingly related to age, with under 25s all owning smartphones, but people aged 55 to 64, you can see more than one in four didn't. And when you reach the over 65, 60% do not own a smartphone. The UK Community Advisory Board is a network of community representatives across the UK, and they undertook a survey last year. 305 responses, mainly via online submissions, therefore not fully representative, showed that 1 in 10 patients don't have a confidential setting at home. And especially considering this was going to be an IT savvy group, still 1 in 20 did not have enough data or digital devices to use remote services. The other thing is around language, and certainly options like Google Translate can be very tempting. But this is a paper from 2014 where they translated 10 common medical phrases into 26 languages and showed less than 60% accuracy overall, which varied widely by different phrases with some really serious errors, and concluded Google Translate should not be used. So, one thing to advise with virtual consultations is always using approved phone or video translation services. Moving to suitability, this will depend on someone's symptoms, whether they need a physical exam, additional investigations, and for someone who may need multidisciplinary input, that can be really difficult to coordinate for a single visit virtually. And when we think about making every contact count, things like cervical cytology in an opportunistic way, vaccination, and targeted lifestyle advice may be things that we miss, of course, in a virtual setting. Thinking of the risks, I think that really is around the missed opportunities, some of which I've just touched on, but also thinking about anxiety and depression and the non-verbal cues that may trigger more in-depth questioning. STI screening, this is gonorrhea, and really importantly, domestic abuse. Certainly in the UK, more domestic abuse during COVID has been reported. And again, picking up on those non-verbal cues can be challenging or impossible in a virtual environment. Finally, preference. And of course, patient choice must be at the heart of what we do. Having said that, we had a number of patients who declined phone services historically, but having experienced them during COVID, have now expressed a preference for that form of follow up going forwards. But we must think about the fact that people's preferences and needs will evolve over time, and making sure our services can adapt and offer people choice when they need it is crucial. Finally, I encourage anything that you do or change is based on evidence. Here are some highlights from non HIV literature. For example, complex or sensitive problems are best dealt with face to face, but of course, you may not know they're going to arise until you've started a conversation. Virtual consultations work better when the patient and clinician already know each other, suggesting a face to face relationship's an important foundation for future virtual success. And here's some of the lessons from diabetes and some clear benefits in terms of non attendance and time, but a tendency to focus more on blood results and the fact, again, that first meetings are better held face to face were part of the conclusions. Finally, although virtual care will work for many people, and actually for many women, it may be good if they've got childcare issues, for example, being able to have your care in your home as opposed to arranging childcare and traveling in could be a benefit. But it's about the falling between the gaps. And when we think about some of the specific concerns, some I've already highlighted, but some very female specific. So, intimate partner violence, and of course, the suboptimal uptake of cervical screening are two really important considerations. The final thing is, again, thinking more broadly about women, is the mobile gender gap. And this report from 2020 showed in low and middle income countries, women are 8% less likely to own a mobile device, with a more than 50% gap between men and women in South Asia. Some of the key barriers to mobile ownership and use are listed there. And in fact, this paper concluded that addressing this mobile gender gap is an important way to help achieve the UN Sustainable Development Goals. So finally, to quote Grace Kelly, I also never say never, I never say always, and I hope you agree with me that though virtual care is important, it's never going to suit everybody all of the time. Thank you very much.